Niger State Primary Healthcare Development Agency has convened a one-day expanded state oversight committee meeting alongside Abuja commitments with local governments, chairmen and district heads. The meeting, which brought together key stakeholders in the state primary healthcare system, was chaired by the Commissioner of Health, Dr. Murtala Muhammad Bagana, held at Husky Luxury Hotel, Minna. The reports.
In his remarks, the Commissioner Niger State Minister of Health, Dr. Murtala Muhammad Bagana, stressed the need for stronger political will and community ownership to improve primary health care delivery across the 25 local government areas of Niger State. He noted that Abuja commitment is a framework aimed at securing increased funding, accountability, and grassroots participation in health intervention, particularly maternal and child health, routine immunization, and disease surveillance. He said an engagement of this kind with stakeholders like chairmen across the 25 local government areas and traditional rulers will reshape our health sector, particularly on surveillance.
Whenever you want to test the strength of surveillance, it is only when you have actually actively searched for a disease. In this instance, it's polio virus. We unfortunately or fortunately, and I will explain why. Unfortunately, we don't want to have any of the circulating vaccine-derived polio around us. But fortunately, it shows that our surveillance system is very strong, active, and that we can actually detect diseases within our environment. So those viruses were isolated in two local governments, Marega and Chanchaga. You were in the meeting a while ago. We have leadership from those two local governments, and they have already picked up in the kind of leadership we want them to provide. You saw from the dashboard that the two chairmen provided leadership throughout the last campaign during the evening review meeting. Those are the kind of leadership we expect from our local government chairman.
Speaking at the meeting, the Niger State Halgon chairman, Ilyasu Zakari, who was represented by the chairman Kotungura local government area, Barrister Bawa Yusuf, said they are playing their total commitment to ensure that all related issues are success.
Like you know, we are the leadership that is directly in contact with the immediate community, with our immediate community. So our support will play a vital role. In fact, it's key to the success of this program, having come from the grassroots. So in that case, we are pledging our total commitment, 100% commitment, to ensure that all health-related issues are success. Success is what we are going to target in everything now. The issue of immunization against polio, nutrition, and other activities, in fact, are in the front burner of our activity right now at the grassroots. We'll make sure that we mobilize our people, we enlighten them towards this, and we give adequate supervision. In fact, in the aspect of funding, we also pledge to give that sector the needed funding that it will require in our budgetary provisions.
It means that we are doing a lot of work because to recognize that there is a problem in your place, it means that the surveillance and the outreaches and the campaigns that we are doing are yielding results. What is left now is for us to be able to ensure that all the children that need to be immunized are captured and they are immunized. And this is something that we are already on top of it. Working closely with the Ministry of Health and with their incident manager. And the Ministry of Health has already activated their emergency call center, and all that needs to be put in place. Working with our partners, World Health Organization, UNICEF are already in place.
Speaking from the traditional rulers' angle, the Emir of Kagara Alhaji Hamad Garba Guna, who spoke through the district health of Damali, Dr. Chindo Ibrahim Bisala, said they will leave no stone unturned by mobilizing communities to ensure that every eligible children will receive vaccination.
Okay, thank you very much for the question. As a traditional institution, our responsibilities are simple and straightforward. What we do at the Traditional Council is to ensure that our communities are mobilized mobilize communities to ensure that for every campaign, they participate actively to ensure that all eligible children get this vaccination. I will also ensure that if there are issues during the course of implementation, we try to resolve those issues like non-acceptance, non-compliance. We'll also try as much as possible to identify new settlement. People migrate from one place to another, will identify new settlement because those are also source of infection that we need to identify and ensure that if there are eligible children among them, they are also vaccinated.
Other key stakeholders also expressed their feeling.
That you are here today and we appreciate your presence. A lot of things have been discussed here. We all contribute to conversation, and then all that we're saying and we will discuss here today is to meet a target goal, and our goal is to improve on the services, health services in Niger State.
Highlight of the meeting was a presentation by Dr. Amina on Abuja commitment, where she presented an update on key performance indicator, challenges in service delivery, and the status of ongoing health projects. Issues discussed include staffing gap at primary healthcare centers, vaccine coverage, and the need for timely counterpart funding from local government areas. Representative of development partners, civil society organizations, and the State Ministry of Health also made commitment to provide technical support and monitor compliance with the declaration. The SOC meeting ended with a resolution to strengthen quarterly review mechanism, improve data reporting from the local government areas, and scale up community engagement through traditional rulers. Ahmad Yusuf reporting for NSTV News.